A high of 83 and a low of 58, and another beautiful sunny day in the forecast for Saturday. We'll see highs near 82 and a low around 60. I'm Lisa Marie with your Beaver County weather.
On this Wednesday, September the 18th of 2024, at 10 minutes past 9, we've got a temperature of 67 degrees with partly sunny skies in Beaver County. That's news. I'm Curtis Walsh on 99.3 FM and AM 1230 WBVP, also streaming at beavercountyradio.com.
Teleforum is on the air on Beaver County Radio, 99.3 FM and 1230 WBVP. The show is presented by East Rochester and Tuska Shop and Saves. And now, here is the host of the show, Eddie Crow.
Sometimes things fall into place. Everybody knows I love when Dale Reckless shows up because we have good fun, but we can be honest about it. Dale's sitting here now. By the end of some of your visits, I get sweaty and even more gross than I typically am. Today, that is not the case. Best case scenario, Dale Reckless of MRS Physical Therapy is my guest, and he brought his own guest today. Would you like to introduce? You are a doctor, correct?
Yes.
That's the automatic with the lab coat, dude. All right, who is your guest?
Are you getting white coat syndrome just by looking at Dr. Hobozal?
No, actually, I find white coats very comforting because I grew up and my mom was a medical household. White coats, there is a sense of inner peace when I see a white coat. And the more embroidered letters, that's the more accreditation.
And in pink.
And in Who is your guest with the perfect ensemble today?
Yeah,
Dale?
so a lot of my listeners know that I love to talk about the foot and ankle. We've spent a lot of shows over the years talking about the foot and ankle. So I'm very excited to have a special guest today, Dr. Kimberly Hobozal, who is known in Beaver County. She's been a doctor in Beaver County for quite some time, but we're super excited to welcome her and invite her to talk about a new practice that she just opened up, Premier Foot and Ankle. So she's gone out on her own and opened up her own practice. And so you'd love to talk about the foot and ankle because as my listeners know, what happens at the foot and ankle is the most important thing that affects the rest of your body. What happens at the foot and ankle affects not only the foot and ankle, but your knee, your hip, your back, the whole chain of command, and it really affects what we do with physical therapy. So I tell my listeners how important it is to take care of your foot and ankle. It's not something that you should ignore. Any kind of pain or thing going on with your foot and ankle, you should take care of immediately, not ignore it. That's something we deal a lot with at MRS Physical Therapy. So I'm so excited to be having Dr. Kimberly Hobozal in today and talking about her new practice, Premier Foot and Ankle. So thank you for coming out to see us today, Dr. Hobozal, and we welcome you to the show.
Thank you so much. I'm very excited to be here. Thank you both for having me. This is something I've never done before. So this is the real deal being on the radio. So I'm excited to talk a little bit about, the new practice. And just like you said, the foot bones connected to the ankle bones, connected to the knee bone. So I always tell my patients, it's like the old nursery song. So it's very, very true. But yes, I've been practicing in Beaver County. I was a resident at UPMC in 2010, graduated fellowship in 2014, and then moved to Beaver County and was with Asp Orthopedics and then Heritage Valley, and just recently decided to go out on my own and start a private practice. So call me crazy, but it's been very much a passion of mine, and finally the vision is kind of come to life. So we are located, Premier Foot and Ankle, at Chippewa. We always say it's right across from the hot dog shop. So that's, a great staple in the area. But we opened up probably about a month ago. We had our the chamber. We had a wonderful ribbon cutting ceremony. And we've been going, full force since. So we said we're off to the races. So we got all of our team members a little horseshoe, especially being from Texas. It's kind of something sentimental for me. But we've been going strong. It's certainly a different patient experience that I've been trying to incorporate. So it's a little different than corporate medicine. Ideally, I'm not having to see, 40, 50 patients a day, and I can spend the time that I'd like to with my patients. without having to rush through in medicine these days. So before I would still spend the time, but I'd run 2 hours behind. So I'm sure people didn't appreciate that. So now I can spend the time with my patient. We have a nice, welcoming environment. So patients that may have the white coat syndrome, we have a very relaxing waiting room. So we have a water fountain feature. We have a comfort menu. So if patients are a little nervous or a little cold, we can get you a blanket, or we can pour you a coffee or get you some water before we take you back to the room. But it's a really nice atmosphere. I'm very excited about it. I will say it's been a lot of hard work, but I know all that hard work will pay off in the end.
Yeah, it's a beautiful new clinic. I was able to go out and visit a couple times to Dr. Hobozal's new clinic, Premier Foot and Ankle in Chippewa. I think when we talk about the medical field, this is something as a physical therapist, I want Dr. Hobozal to talk to the listeners about what does it mean to be a podiatrist, what kind of things you see, what kind of things you treat, because as a physical therapist, I think there's a lot more that you do as a podiatrist than people are aware of and think about. A lot of people think about podiatry as like, well, that's where I go to get my toenails clipped. But it's so much more than that. And you actually, you do foot and ankle surgeries and you guys do the whole deal. So if you wouldn't mind, Dr. Hobozal, just kind of explain to our listeners, what does it mean to be a podiatrist, and what is the extensive amount of things that you do as a podiatrist for those listeners? Yeah,
sure. Being trained at UPMC under Dr. Patrick Burns and Dr. Dane Wookage, I had an extensive orthopedic type of residency and fellowship. So we did do a lot of focus in Charcot-neuropathy, Charcot reconstruction. In fact, I think I brought an external fixator here to show you or scare you today. Not you, Del. I know you know how to deal with that, but anybody watching the Facebook Live. But, we do a lot of diabetic foot infections, anywhere from total ankle replacements, ankle fusions. We do bunions, hammer toes. I mean, really the whole gamut. I do a lot with sports medicine. A lot of my patients, possibly they were, younger in sports and having some lateral ankle instability. So we work very closely with you as physical therapists too, to regain some of that strength for our younger athletes, as well as our older athletes. The pickleball. Mm-hmm. Pickleballers out there, I guess, if you want to call it that, Achilles tendon repairs. I really haven't done a lot of the routine care in my practice over the last 10 years. However, in this new practice, we do have something called the Pedi Spa. So I have a licensed nail technician. So for those patients that are high risk, maybe with diabetes or peripheral arterial disease, we do have that option for them to have a sterile pedicure, if you will. It's waterless, and there's decreased risk of infection, fungal infections, things like that. So we have that option as well. So for those patients that need that, we still offer that service. I also do a lot of minimally invasive surgery. That's kind of where, everything's kind of moving. Ideally, patients, we want to get them back to moving as fast as possible. As you know, it's very important, for recovery and, working with the therapist to do so. So if I can keep that incision as small as possible and get patients back on their feet and keeping them mobile, that's ideally what I want to do. So we do have that minimally invasive suite. That was something that I was really excited about to have in the new office. And we're able to do minimally invasive bunions, minimally invasive hammer toes, some tendon releases, some smaller procedures that only require local anesthesia in a nice sterile environment for these patients, so they don't require, to go to a facility or a hospital to have those types of surgeries done. But of course, I also do, I think one of my bigger passions is a total ankle replacement, or patients that maybe have a flat foot that have difficulty walking or knee pain because of the way their foot is structured or their biomechanics and the way they walk. So realigning the foot, and seeing them walk again and kind of seeing that story play out for that patient that may have had pain for so long that couldn't, play with their grandkids or do the activities they wanted to do, and after the surgery and after the rehabilitation, and then being able to do that and walk into the office again, it's that's something that really resonates with me.
Yeah, and I'll say, Dr. Hobozal's been practicing for, you said 14 years in the Pittsburgh area as a resident and 10 years as a full-fledged podiatrist. And I've seen Dr. Hobozal's patients, and her outcomes are fantastic. I love working with your patients. The surgery that you guys do is always, top line fantastic. So I would say to listeners, if you need whatever your need is for the foot and ankle, Dr. Hobozal really will have the answer for you. She's the great go-to person for any foot and ankle needs you have, whether it's something simple or if it's something more extensive. And when you talk about a total ankle replacement, that's a really high level extensive surgery to have if you get to that point. So I'm super excited that you have your own practice here in Beaver County, and we have the opportunity to have our listeners and the people in Beaver County take advantage of your high level of skill, because I think it's fantastic. Now, how do people get a hold of you if they want to make an appointment? What does that look like? Do you have a phone call, or can they do an online appointment, or what do you guys have set up right now?
Sure. Well, we have both options. So if you still like to pick up the phone and talk to somebody, we have our front desk coordinator, Diane, and she'll answer your phone call. That phone number is 412-830-STEP. So it took us a while to finally find a nice number that we could have a fun, step or pain or toes or whatever.
Right,
but yeah, that's 7837 STEP. So, you can give us a call. We can talk to you, about what kind of pain you're having, what type of appointment you may need. We also have a website, www.premierfa.org. Where you can find a lot more information on the website regarding the services that we provide, anywhere from the MIS surgical suite to the types of ankle repairs, replacements, fusions, sports medicine surgeries, as well as some ancillary options. We have some regenerative type of therapies that we do offer for patients that maybe surgery just isn't in their in that season for them at this point in time. So ways to try and decrease the pain and keep them mobile and keep them walking. You can find information about that as well as the Pedi Spa on the website. There is a nice little link there where you can set up an appointment, and we can certainly text you through that link and answer any questions you may have.
So I come in, I'm listening today, and my foot and ankle's kind of hurting me. And I'm like, I'm going to give Dr. Hobozal's office a call and have her take a look. What does a first-time appointment look like? What would I expect coming in as a new patient for you?
Sure. Well, we do some direct care services as well. So that way I have, a great amount of time that I can spend with my patients. So you would call in, let me know what type of pain you're having. We'll bring you back into the office. You'll meet with my medical assistant, Sam, and she'll go ahead and take your history and talk to you about what's going on, and then I'll come into the room. At that point, we'll do a full examination, history and physical on you. I'll be able to spend some time talking about what your diagnosis and some treatment options that we can provide for you, whether it be from conservative options up to surgical options. Something that I really enjoy in the office is imaging. So we're able to do some live fluoroscopy in the office. So I think patients really enjoy that. I actually go through the x-ray examination with the patient, and I can say you have pain in your ankle. So we can actually get you underneath the C-arm, which is a fluoroscopy type of device, and we can start moving your ankle up and down, range of motion. And the patient's able to actually watch this on the screen so they can see what type of motion they have. And we talk about how much motion you should have to be able to walk without pain, or how this could be affecting your knee, your hip, things like that. I'm able to go through that with the patient and show any type of bony abnormalities as well. So I think it, really the patient starts to understand a little bit more about their health, about their foot and ankle health, and they're able to invest a little better than just saying, well, this is what you have. This is your diagnosis. This is what we're going to do now. So if they really understand, the pathology, the biology behind it to an extent, and understand why maybe they're walking the way they do, if it's a tendon issue, if it's a bone issue, if it's a strain, or maybe they need an orthotic or something like that. They can really understand it through, our discussion and the imaging, and kind of go from there. And what I like about it is I'm able to kind of provide the patient a treatment plan. So I go back to the office before the patient leaves and actually type up a little treatment plan about what we discussed in the office today, because sometimes it can be a little overwhelming for a patient, especially the first time they come in, to really understand what's going on. So I have everything printed out for them. They can show them to their family if they have any questions. and a kind of a guide by guide basis. This is what we're going to try first. If this doesn't work, then we have another option. Or, if this is a surgical repair, this is what we're going to do. Are we able to do it in the MIS suite, or do we need to go to the hospital? And, so I think having the patient engaged in that process is really encouraging. And I think it's, makes a big difference in the patient experience and the patient recovery.
That's a great opportunity, because what I'm hearing is kind of like a one-stop shop. I can't tell you how many times as a physical therapist I asked a patient, did you go to see the doctor? And they said, yes. Well, what happened? Well, they ordered an x-ray. So they had to go to make another appointment to order an x-ray. Well, what did you hear about the x-ray? Well, I don't know. I have to go back and see that doctor again. So you're talking like 3 appointments before you even get the results of what's going on. But in your practice, you really, with your first appointment, you can do all that evaluative, components, see what's going on, meeting with your first visit, come up with a game plan your first visit right away. So I think that's an amazing opportunity for patients.
Yes, thank you. Yeah, we have a weight-bearing CT on its way, so that's been a long time in the works. And, everybody, I talked to everybody in private practice prior, and they said, okay, start small. You don't really need to go big. And what do? I went big. So I'll probably be paying for that for a while. But I did that for the sole purpose of the patient. So I did want that patient to be able to have access to that in the office, and me there to be able to evaluate it in real time. So we also have an ABI, the Smart ABI, which will evaluate blood flow anywhere from, basically evaluating the arm pressure, just like a blood pressure cuff, down to the ankle. We can evaluate the oxygen pressure to the toes, because a lot of patients, maybe with diabetes, also have peripheral artery disease. And I want to make sure they have good blood flow going to their foot before I do anything, surgical for that patient. Or maybe a patient has a wound that I'm treating. So we want to make sure they're optimized. And if we need to bring in other providers or other, doctors, vascular surgeons, we want that continuity to be there as well. So we also evaluate, neuropathy. We see, obviously, together we see a lot of neuropathic patients, and that's a very difficult pathology to treat. So trying different modalities for those patients, that's kind of what we want to have available to them in the office. So if this isn't working, well, now let's move to this, and that way we get a full diagnosis and a full treatment plan while they're there.
Yeah, so when I came into your office, that's something that I was very impressed with. Not only was it a beautiful new office, but you have a lot of cool different equipment there. So, there's nothing basic about it. It feels like you have everything you need to do a full evaluation, right in your practice itself. Tell us a little bit about some of the other equipment that you have, because there are a couple other things that I saw there that I don't see in too many places. It seemed pretty unique to your practice to have that available for your patients.
Sure. Well, one of our options for different pathologies, including tendinitis, fungal toenails, wart therapy, neuropathy, is something called the Remy laser. It's something that provides the patient a different alternative to surgery or to even chemical drugs. So we've been utilizing it, especially for fungal nails. And being in a corporate medicine, I didn't have the access to it I did before, or like I do now. But I have heard patients discuss it, and I was like, "What is this about?" So I started doing some research, and we have had some really, really great results regarding, the treatment therapies that it can provide. So it's actually light raised, penetrating the tissues to decrease inflammation, to decrease fungus. We have that. We also have the stem wave, which is a type of shockwave therapy. We've seen some great results regarding all different types of musculoskeletal problems, anywhere from knee pain, shoulder pain, ankle pain, those types of issues that we can utilize that for as well.
Okay, so stay tuned, folk. We're going to take a short break here. When we come back, Dr. Hobozal has brought some interesting visuals for us to look at, and we'll talk more.
Dale, what do you need me for?
This is pretty cool. I'm thinking like this might be my new side gig.
I am sitting here and I'm going,
People are like, is Eddie even there?
Yeah. Oh, no, you pleased him on that turn anyway. Dale Reckless of MRS Physical Therapy. I serve no purpose, but I'm learning stuff. I'll learn more after news.
Tune in to Beaver County Radio after the Friday night football game for the 35th anniversary season of Falcone's Moon Township Ford Wrap-Up Show. Beaver County Radio's Bruce Fry and Ryan Garazunas will have the scores, standings, and any news from the games. They will also take your phone calls so you can talk about your favorite team. The Falcones Moon Township Ford Wrap-Up Show is being brought to you by Carver Construction, the St. Barnabas Health System, Beaver County Career and Technology Center, Falcones Moon Township Ford, the YMCA, the Beaver Falls Municipal Authority, Patriot Home Care, Keystone Wellness Program, Fry Transportation Group, Freedom United Federal Credit Union, the Community College of Beaver County, Friendly Federal Credit Union, Fat Boy Cigars, Geneva College, and Beaver County Radio.
Beaver County Radio and the Pennsylvania Hot Rod Company, along with AK Nahas, are teaming up to present Cruisin' on the Ridge. Saturday, September 21st will be the final car cruise of the year, so make plans to come out and send summer out with a bang. If you have collected all of the dash plaques, you will be entered into a special drawing to win a special prize. Cruisin' on the Ridge will be from 12 to 4 p.m. at Beaver County Radio Studios at 4301 Dutch Ridge Road in Brighton Township. Beaver County Radio's Solid Gold Saturday host J.D. Merkel will be spinning tunes in the parking lot. There will also be food trucks, prize giveaways, raffles, and a 50-50. Cruisin' on the Ridge is being brought to you in part by Patriot Home Care, Fry Transportation, J. Young Refuse, the William Murphy Funeral Home, the Beaver Valley Auto Mall, AK Nahas Furniture and Appliance, the Pennsylvania Hot Rod Company, and Beaver County Radio.
Looking for that special home or wanting to sell yours? Let the Lisa Latham team, brokered by eXp Realty, help you. Hi, I'm Tank Latham, and our goal is to make you feel comfortable whether buying or selling. Lisa and I strive to make the process as smooth and as easy as possible. We invite you to visit the all-new eXp office located at 926 3rd Avenue, New Brighton. Give us a call at 724-307-5472. Check out Beaver County Home Inventory on our website, lisalatham.com. The Lisa Latham team, results that move you.
Beaver County Radio's news source, 95.7 and 99.3 FM, along with 1230 WBVP, 1460 WMVA, and streaming at beavercountyradio.com. Here's Curtis Walsh.
Good morning on this Wednesday, September the 18th of 2024. We can expect mostly cloudy skies today, reaching a high of about 77 degrees. We'll have a complete Beaver County radio weather forecast after we take this look at news. Aliquippa police say that they're still investigating a shooting that took place at a children's playground. Shots were fired Sunday afternoon at the Eleanor Red Playground in Plan 11. Nobody was injured, but youths were forced to run after playing basketball at the park. Police say that they have identified both the vehicle and the shooter, and they are actively working on the investigation. The Center Township Supervisors approved a land consolidation plan. Beaver County Radio News correspondent Sandy Giordano reports that C.J. Betters asked the township to approve a consolidation of two properties, with one half of the land located in Hopewell Township on Woodlawn Road and the other half on Constitution Boulevard in Center Township. A spokesperson for the township says the property may be used for future development on the riverfront. The supervisors will meet next on Monday, October 21st at 7 p.m. Temperatures are rising over pickleball in Cranberry Township. It's far and away from the fastest growing sport in the United States, attracting waves of retirees and young people alike. Pickleball has grown by more than 200% over the past 3 years, now boasting 36 million players nationwide. Locally, Cranberry Township is the region's undisputed pickleball mecca, featuring an unrivaled complex of 19 state-of-the-art courts, though not everyone who lives close by is thrilled. Some people are not happy about the noise coming from the courts, but that isn't their only complaint. The courts are run by the Cranberry Township Pickleball Association, and though the courts are situated in Cranberry's Graham Park, they're not open to the public. Residents have daily access to just 3 courts from 1 p.m. to 4 p.m. and can't play on the others unless they pay the association's $100 plus membership fee. But even if they want to become members, they say they need to get in line, as there are now hundreds of people on a waiting list to join the association. In the meantime, the township says it is trying to fix the noise problems, and they will also be building 2 public-only courts in another park. A new report says the U.S. has seen an increase in the number of a certain kind of derailment related to the forces created when rail cars push and pull against each other as freight trains have gotten longer. The National Academies of Sciences Tuesday released a long-awaited report. It says that regulators, Congress, and the industry should re-examine the risks associated with long trains and make sure they are addressed. The report said railroads must take special care in the way that they assemble long trains, and that's especially